Welcome to our channel. Today, we're diving into a topic that affects millions of people and families around the world: drug addiction. It's more than just a habit. It's a complex disease that rewires the brain, impacts behavior, and often destroys lives. But there's hope, in understanding, in treatment, and in recovery. So stay with us as we explore what drug addiction really is, how it develops, the science behind it, its devastating consequences, and most importantly, the path to healing. Drug addiction, also known as substance use disorder, is a chronic, relapsing disease characterized by compulsive drug seeking and use, despite harmful consequences. But it's not just a matter of willpower. Addiction affects the brain, particularly areas involved in reward, motivation, learning, judgment, and memory. When someone repeatedly uses a substance, whether it's alcohol, opioids, cocaine, meth, or even prescription drugs, their brain starts to adapt. Over time, it becomes harder to feel pleasure without the drug. This leads to a cycle of dependency. Addiction is not limited by age, gender, or social status. It can affect a teenager experimenting with pills, a working parent using painkillers after surgery, or a senior managing chronic illness. The truth is, no one chooses to become addicted, but everyone deserves a chance to recover. Addiction often starts subtly. It can begin with curiosity, peer pressure, a prescription from a doctor, or even a desire to escape emotional pain. At first, using the substance may feel good. It creates feelings of euphoria, relaxation, or relief. But the brain quickly starts to depend on that substance to produce these feelings. Over time, more of the drug is needed to get the same effect. This is called tolerance. Eventually, stopping the drug can cause intense withdrawal symptoms, like anxiety, nausea, tremors, or depression, making it even harder to quit. Addiction hijacks the brain's reward system, a part of the brain that is meant to help us survive by reinforcing behaviors like eating or socializing. The drug tricks the brain into believing it's essential for survival. Let's take a quick look at some commonly abused drugs and how they affect the body and mind. Opioids. These include heroin and prescription painkillers like oxycodone or fentanyl. They block pain but also slow breathing and can be deadly in high doses. Stimulants, drugs like cocaine, methamphetamine, and ADHD medications like Adderall. They increase energy and alertness but can cause paranoia, heart problems, and aggression. Depressants, alcohol and tranquilizers slow brain activity. While they can ease anxiety, abuse leads to blackouts, respiratory failure, or death. Hallucinogens, LSD, psilocybin, magic mushrooms, and ketamine alter perception and mood. These may lead to dangerous behaviors or persistent psychosis. Cannabis, although increasingly legal for medical and recreational use, high doses or frequent use, especially in youth, can impair memory, motivation, and mental health. Each of these substances has different effects, but all have the potential to cause addiction and harm if misused. Why do some people become addicted while others don't? There's no single answer, but several risk factors play a role. Genetics. Addiction often runs in families. Some people are biologically more vulnerable. Environment. Stressful home environments, exposure to drug use, poverty, and lack of support can increase risk. Mental health. Anxiety, depression, trauma, PTSD. These conditions often overlap with addiction. Early use. Using drugs at a young age, when the brain is still developing, increases the likelihood of long-term addiction. But remember, having risk factors doesn't guarantee addiction, and lacking them doesn't make someone immune. The impact of drug addiction can be devastating and far-reaching. On individuals, it can damage physical health, increase the risk of overdose, and worsen mental health. People may lose jobs, drop out of school, or experience homelessness. On families, addiction strains relationships, causes financial hardship, and often leads to neglect or abuse. Children of addicted parents may suffer long-term emotional trauma. On society, healthcare systems, legal systems, and economies bear heavy burdens. In some countries, drug overdose deaths now outnumber traffic fatalities. One of the biggest barriers to recovery is stigma. Many people still see addiction as a moral failure, as something shameful or weak. But addiction is a medical condition, just like diabetes or asthma. And just like those conditions, it needs proper treatment. Shaming people who are struggling doesn't help. It pushes them into isolation, makes them hide their problem, and delays their healing. If we want to help, we need to replace judgment with compassion, to see the person, not just the problem. The good news: recovery is possible. Millions of people around the world have overcome addiction and gone on to lead healthy, fulfilling lives. Treatment can take many forms. Detox, the first step, where the body clears the drug, often needs medical supervision due to withdrawal risks. Behavioral therapy, counseling, cognitive behavioral therapy, CBT, and group therapy help change thought patterns and triggers. Medication-assisted treatment, MAT, for certain addictions, medications like methadone or buprenorphine reduce cravings and withdrawal symptoms. Support groups, groups like Narcotics Anonymous, Alcoholics Anonymous, and online forums provide community and accountability. Rehabilitation programs, inpatient or outpatient programs provide structured care and support. Relapse can happen, it's often part of the journey. But with each setback, there's a chance to learn and grow stronger. While treatment is essential, prevention is powerful. Education, teaching young people about drugs early, in schools and at home, can reduce experimentation. Healthy environments, stable families, open communication, and strong communities protect against addiction. Healthcare access, mental health services, early screening, and proper pain management reduce risk. The earlier we intervene, as individuals, families, or societies, the better the outcomes. Drug addiction is real, it's painful, but it's also treatable. If you or someone you know is struggling, you are not alone. Reach out, get help, recovery is possible, and so is a better future. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel. Together, we can raise awareness, end the stigma, and support those on the path to healing.